Hello, this is Carmen Enoh. I am a student pharmacist at the Benin Métivier College of Pharmacy. Today, I'm going to go over some important informations that you need to know about your medication morphine. Morphine is an opioid analgesic. It can be found in the tablet capsules, liquid, suppository, and even injection form. Some brand name for this medication are Arimo ER or Duromorph. There's also many others brand name of morphine found over the counter in the US market. However, those are the most common that we see. This medication is used to treat severe pain. How should you take this medication? This medication may be taken with or without food. However, you may take this medication with food if you have an upset stomach. Do not inject or snort this medication as it may cause you to have very bad side effects like trouble breathing and even death from overdosing. Do not use this medication for fast pain relief or on an as needed basis. Also, do not use this medication for pain after a surgery. If you have not been taking opioids before, take this medication at the same time of the day. And do not put this medication down a feeding tube. Also, only use a measuring device to measure the liquid formulations. For the suppositories form, make sure you use it only rectally, and if it is too soft, you can chill it in the refrigerator or run water over it. For the injection forms, um, it can be given as a shot into a muscle, vein, or fatty part of the skin. And to lower your chances of feeling dizzy or passing out, you may rise slowly if you have been sitting or lying down for a long time. Also, be careful when you go up and down the stairs, and do not stop taking this medication suddenly, as you may have some withdrawal symptoms like anxiety, sweating, or diarrhea if you do so. If you miss a dose, skip the missed dose and go back to your normal schedule. It is very, very, very important not to take two doses at the same time. You may also call your doctor to figure out what to do if you are not sure. What side effect can occur with this medication? With this medication, you may feel dizzy, sleepy, tired, or weak. Sometimes you may have dry mouth, constipation, diarrhea, stomach upsets, stomach pain, throwing up, or feeling less hungry, as well as headache, anxiety, or excessive sweating. Before taking this medication, you should inform your healthcare provider about any allergies that you may have to this drug, any other drugs, or food substances. And if you have any of the following, also tell your healthcare provider. Those are lung or breathing problems like asthma, trouble breathing, or sleep apnea, high levels of carbon dioxide in the blood, stomach, or bowel block or narrowing. If you have taken certain drugs for depression before or for Parkinson's disease in the last 14 days, you may also want to notify this to your healthcare provider. Some example of those medication are isocarboxylides, phenelzine, trinylcypromine, Seligene, or razagiline, as this may also may cause you to have very high blood pressure when they interact with morphine. If you are taking linezolid or methylene blue, also tell your healthcare provider. Inform your healthcare provider as well if you are taking opioid medication or narcotic used for pain as well. Some example are buprenorphine, bu- butorphanol, nabulphine, or pentazocine. For the injection, if you have an infection at the site of the injection, please let your healthcare provider know as well. Let your healthcare provider know if you have any bleeding issues or if you are currently taking a blood thinner. All oral product and suppositories should be stored at room temperature, protected from the light and in a dry place, not in the bathroom. For the injection, you may store the injection at if you have to store the injection formulation of morphine at home. You may talk to your doctor, nurse, or pharmacist directly so they can direct you specifically about how to store it. For all other products, keep them safe and out of reach of children and anybody else. And please remember, this is a controlled substance, so this medication can be easily abused, and so it is very important to use it as prescribed by your healthcare provider and not to share this medication. Remember that if you have any questions at some point, you can always call and contact your pharmacist or your doctor. Thank you.